It was unclear to lawmakers what Mr. Trump meant by generous, although it seemed a likely reference to tax credits that would make health insurance more affordable. The divisions facing a healthcare overhaul in the Senate are many. Senators from states that expanded the Medicaid program are not eager to roll it back. At the same time, however, other senators are angling to use the process of repealing President Barack Obama's signature healthcare law as an inroad to greatly curtail the nation's Medicaid program writ large. On Tuesday, it seemed that Mr. Trump was putting his finger on the scale with the more moderate members by criticizing a bill he celebrated with more conservative House Republicans. Senators, who are growing increasingly indifferent to Mr. Trump's policy interests, did not seem moved by his entreaties, the congressional aide said. But it did give fodder to Democrats who are likely to revel in Mr. Trump's derision of his party's bill. The House Democratic leader, Representative Nancy Pelosi of California, did not pass up such a gift from the president. She wrote on Twitter that Trump care, as she called it, was not only mean, but a moral monstrosity. The Senate bill is just as cruel, she added, although no bill text has been released. Republican senators were already planning to make their bill more generous, at least relative to the House bill, known as the American Health Care Act. At the Capitol, the Senate Majority Leader, Mitch McConnell of Kentucky, said Republicans were hard at work on their legislation, although he did not divulge any specifics about it. "Our goal here is to move forward quickly," he said. "The status quo is unsustainable." The Congressional Budget Office found that the bill passed by the House would leave 14 million more people uninsured next year than under the Affordable Care Act and 23 million more in 2026. It also said that the House bill would cut more than $800 billion from projected federal spending on Medicaid over the next 10 years, and that less healthy people could face extremely high premiums, as would some older Americans. For example, the Budget Office said, for a typical 64-year-old with an annual income of $26,500, the net premium in 2026 after tax credits would average about $16,000 a year under the House bill, compared with $1,700 under the Affordable Care Act. Doctors and hospitals oppose